what I did, is, at least in my own due diligence, is that from my own safety standpoint, I certainly wasn't there to get killed or ambushed by Russians or, lose my life or, lose an arm or leg. I certainly, God bless, morality and civility and society and fighting the fight and all that. I'm certainly there, but I certainly wasn't going to take any risk for myself and my family and my work. And I had to do a fair amount of due diligence to know that I was going into the far, far southwest part of the country in a town called Chernivtsi. And Chernivtsi is about 250,000 size city. Basically, it's a city. And that was going to be our home base where we were going to work with the BBC and go to several institutions in and around the Chernivtsi area. And these are locations that were set aside or worked on by DRI ahead of time. They had the date, they had the location, they had the meeting. So there was a fair amount of pre-planning that went into us going there. But what I realized is that all the best plans can be thrown out the window when you get there and knock on the door, and they often look like they don't know who you are, like you have like a third eye, like who are you and why are you here? And this is all through interpretation by between our Ukrainian operative and they being Ukrainian, speaking about we're going there with a camera and a crew, and like why are you here and what's your intention and what's your plan and all that. So we went to 3 different institutions, and the 3 different institutions in around that region, that area, were different in some respect in terms of the age of the individuals there and the location and such like that. They weren't all identical. One of them was a baby house, and they called it a baby house, and it's basically for little babies and little young children, age maybe 6 months. Oldest could have been several years old. And by and large, a lot of them were given up as orphans by their parents because they had developmental disabilities. Some of them were displaced from other institutions from the east where the war is going on, far to the east. So it was a mixture. And so each of the institutions that we went to, different age, different people there that were either originally there because they were just put in there by their families and the state accepted them into Ukraine, or a percentage of them were displaced from other institutions from the east. So there's a mixture. And then in each institution, there's also different levels of the disabilities that they have. And the one thing that I noticed as a physician, which kind of broadened up the idea about the quote unquote care of this population, is that I didn't, and as a developmental neurologist who sees, a lot of people with significant developmental disabilities from very early on till throughout their lifespan, is that some things that are very, very common in certain levels of disabilities, you might have someone with a severe cerebral palsy. So their arms and legs may not be moving very well, and they may have a lot of increased tone and stiffness or extremities. And it's clear that if that kind of difficulty they have often from birth is not managed early on, from the first days of life throughout their early young children and adolescents into adults, basically what will happen is those extremities will become more and more immobilized and frozen or rigid, and you're done for it, because once it's kind of locked in, you get like frozen joints where you can't do much for. And so what was very apparent in terms of in medical intervention and thinking about neurologic complications, spasticity is one of them, is that there's no early intervention. So they're not provided any type of typical therapeutics that spasticity is mandated, at least in the United States, medication to make relaxation limbs, shots of Botox or surgical interventions to help the extremities or the joints become more flexible. So right now there is nothing that I saw in any of the 3 facilities that I went to. So since I saw people younger, and I saw people middle age and then older people, you then got to see what happened when you don't do anything for a baby or a child. Basically, they get worse and worse and worse with their stiffness or immobility, and it then leads into various levels of malnourishment, bone loss, and early death. So you have a lot of people that weren't even living. I can't say, when they die, but in this film, in this work that we did, when the visits we had was with Richard Engel. We met with Richard Engel, and the reason I'm bringing this up, because he went to, after we interviewed with Richard Engel, in a small town in Ukraine. He himself went to another institution, another one, not that I was at that one, but it was similar. And you can see a lot by his video. And I don't know if you want to link this. And when you put whatever you put out there, there's a lot of material out there that really visually demonstrates. I'm talking about it. There's a lot of reference material by the BBC, by Richard Engel and NBC News, photographs, videos that basically are shocking about what you're actually seeing in Ukraine by living in these institutions, including untreated spasticity, malnourishment, thin limbs, etc. And people end up dying from the lack of care. And one of the things that they often die from is aspiration pneumonia, because if you're immobilized, you can't move around in bed and you can't eat well because everything gets frozen up and locked up. You can't swallow well, and you're not providing any additional full supplement or feeding tubes or any aggressive care. You die. And that's basically, I hate to say it, but that seems to be just the reality, that they just end up dying early. And the oldest person I saw was maybe 42 years old. And there's no other geriatric facility that, wait till Dr. Keller, you go to another facility and that's where you're going to see older people. They're not. And I do believe, based on my understanding of what we saw in the facilities and the additional ones, Richard Engel and other ones that DRI has been with, this is what it is. This is, quote unquote, normal for Ukrainian institutionalized care. And I believe that the numbers in their state institutions are over 100,000, people. But there are some people that live in community with developmental disabilities. And I'm not saying it's 100% in institution care. So I know what I saw. I know what I did. And maybe in some level of community care, things are maybe relatively different, but every indication that I have based on our conversation is that the level of family support, child born with a single developmental disabilities, mother or father going into the neighborhood or into the community to get care by a knowledgeable healthcare practitioner, a neurologist, what have you, or early intervention by physiotherapists, physical therapists, by practitioners that know how to treat them, is basically, by and large, really not a lot. There's really not a lot within, I think, a large part of Ukrainian society. The universities that are there, and there's certainly, very magnificent universities in associated with a lot of cities in Ukraine. I don't really know. I don't really know on how much they do or can do and such like that. But going back to the institution, one thing that was also relevant aside from spasticity care is care for epilepsy. Epilepsy, seizure disorders is one of the, besides from spasticity, is a very, very, very common and prevalent neurological complication in the developmental population. And so aside from me looking and seeing individuals there in the Ukrainian institution that I saw, I was also asked to consult on several individuals by the doctors in these facilities because I gave them my card. I mean, I came there with DRI as a representative, but I'm Dr. Keller, neurologist, expert in developmental disabilities, epilepsy, what have you. And so I wanted to be able to, at least if an opportunity arose, that they would actually ask me questions. So they did. So I was able to see in several institutions individuals that they themselves were seeing with developmental disabilities, with relatively significant seizure complications, and they wanted to ask my opinion about how I would manage them. So I was able to get a front row seat on how they themselves manage it themselves. What do they do? What do they think? How are they treated? And I was shocked. I was actually shocked on many levels. One, I was shocked because well, I guess maybe not totally shocked, but I did know that some of the pharmacologic medication, the pills that we routinely prescribe in the United States for different seizure problems, they're very limited. So I guess I should be shocking they don't have everything we have in the United States. So they have very limited number of different medications. And for those with developmental disabilities, there's certain medications that are more nuanced for developmental disabilities, for like Dravet syndrome or Lennox-Gastaut syndrome. These are syndromes that have a high rate of seizures, and there's certain pharmacological medication that seem to have more attention to reduce those kinds of seizures, those populations. Well, forget that. They're not having it in those medications available. The other thing that I recognize in my discussion with the physicians there is they don't do blood testing. So if they want to know if the person's kidney, liver is off, or blood count is off, or if they want to measure or monitor a seizure drug level, if they can do that, the most availability they had is like twice a year. And that was like a labor for them to even do that. Nothing medically is done within the facility, no blood draws, things like that. It's just caretaking, as far as I could tell, in the facilities. So any medical aspect, aside from doling out medications, is that any intervention, including blood tests or CAT scan, MRI, x-rays, would have to be done at a local hospital or hospital away. And it seems that for the individuals, the directors, the medical directors, the physicians there to kind of like make this decision that, boy, this is a crisis for this person. I'm going to really bend over backwards, call an ambulance and bring them out there. I think the bar, it has to be set so high that they're not doing it. You never see it at all. They're just keeping people there who have a lot of seizures, and they don't have a lot of medication for them. They don't do any blood tests for them. And the other thing they don't really do is they don't have what's called rescue medication. Rescue medication would be basically like an injectable or a administered drug, like usually like a benzodiazepine, like Valium or things like that, which are those that would be able to stop a seizure from recurring or stop it from being prolonged. Because it's a controlled substance, they basically don't even have them available for various legal reasons. So people would, I guess, would continue to seize. And I saw one individual that I was asked to consult on who was apparently repeating seizure day after day after day. And they got advice from a local, maybe university neurologist, from what I understand. And they were administering this individual this intravenous glass bottle through this tube to this individual that was like 20 some years old, a drug called mannitol. And mannitol is something that's often given for people that have raised intracranial pressure and are about to herniate. And I'm like, I'm like trying to, and this is all through interpretation. I can look in the bottle, it says mannitol. They're showing me the medical record through the interpreter standing next to me. And I'm like listening. I'm like, wait, what? You're using what? And why are you doing it? So I had a hard time as they were asking me advice. What would I do? What would I do? What would I do? Because basically I'm an American physician who's almost spoiled because I have all these tools and resources for me. So my first immediate reaction was I felt like an idiot. I felt foolish in a way that I was almost like here as an American coming there being very ignorant and naive about what I was thinking I could do when they don't have any resources. The physician themselves are basically they're in a tough situation. They don't have the resources, experience, knowledge, or resources to care for them. And so it's almost like, what can they do? And so I really had a hard time. I did give some advice in some respect, but I had a hard time really giving them some kind of great expertise, because my training is all based on knowing that I have all these blood tests and these monitoring and medication, and they don't have anything. So it's almost like, just try this and throw this at them, or do this and that. And you have no way of monitoring and no measurement or something like that, no EEG, no scan of the brain. And so it's really, and that's normal. But what I don't believe is that's normal in the community. So if you had, and this is my own sense about it, I can't say I compared developmental institutional care to people in the community who don't have developmental disabilities in their own community. Is that how they are treated? Are they treated the same way? No blood test, no imaging, nothing, and they have limitation? I imagine some of that may be true. But again, my initial bias based on my own sensing of what I do see is there's a huge double standard. People with developmental disabilities, I think, are so-called treated one way badly, and maybe the normotypical people are treated another way. And I really think that's a big part of the cultural difficulty within Ukraine society, similar probably like many other countries that are in that same general region. Ukraine is not alone in this, even though I'm talking about Ukraine in my visit with Ukraine. And the problem is that Ukraine's only been out of the Soviet Union not many years ago. So it's not like it's been around for 50, 100 years like the United States, where we had to, learn and evolve legally and do other things that kind of get to where we're at now, which is still needs to improve. But Ukraine is still basically ups and downs and back and trying to figure themselves out. And they've only become, trying to get more democratic and more liberal in what they can do in their own society. And then the war happened. And so the issue about the war is that the government theoretically before the war was talking about some levels of reform for the institutions and try to make good. But I think in some respect, they were basically dragging their heels even before the war about investing in society, investing in family support, investing in community. And maybe the most that they were maybe looking to do probably is dress up the institutions to make them look better and to function better from their own viewpoint. And so what the war has done is it basically kickback reform, delayed reform, and it also made the staffing more of a difficult part because there's now more people in other facilities with not as many staff. So they didn't, even though the individuals from the East were kind of displaced into some of the Western institutions, I don't have any sense that they brought in a lot more staff to carry for that more larger number of individuals. So you're having, more people there, less staff, less attention, and you're getting even more problems of it. And then the issue about reform is that the government, and we did meet one day with governmental leaders in the Chernivtsi Oblast. Oblast is like a province, equivalent to like a province area, like a state, I guess. So we met with governmental leaders in the Chernivtsi Oblast. We met with them. The governor, the ministries of health, education, and social policy, and we met with them, across from each other at a table in the governmental building, and we asked these tough questions. What are you going to do? What is going on? Where are they at? Where are they displaced? Or where are you going to be moving on with them? And how are they going to get care? And the typical, question that they would often have is that there's a war going on, and right now we're dealing with the war. But my own giving my counterpoint to that is that in everyday society, and from what I gather in very large parts of Ukraine, the average citizen is still getting services and supports. Mail is being delivered. Food is stocked to some degree within the stores. Restaurants are open. I mean, even in Chernivtsi, when we were there hanging out at the institutions, we would go out to dinner at night to this really nice restaurant and having beer and ribs with our BBC crew. It was kind of this really surreal dichotomy between, I'm here as a tourist, I'm here at Ukraine, but then, and we're all having entertaining time, and even though there's a war, it was surreal. It was really a really surreal mentality that I kind of saw it for what that.